Hi guys, this is Coach Bill with Fat Loss Made Easy online personal coaching. Hope you guys are having a great day so far. Today guys, I want to go do a little short overview of our diabetic course that we are offering here on our online personal coaching. And some of you might have been a type 2 diabetic for a year or two, and some of you might be a type 2 diabetic for the last 10 or 15 years. Well, what we have done is we have designed a program, a course for you to be able to reverse your type 2 diabetes and also possibly get off the medication for the rest of your life. Now, I'm not a doctor. I'm not prescribing a treatment. I have 40 years of experience working with type 1 and type 2 diabetics. And in the last few years, it seems like type 2 diabetic has gotten even worse. Now, most of you probably already know that type 2 diabetic in the young and old is an epidemic now. And in the last 2 or 3 years of this COVID, it's gotten even worse. Well, this program, this course, is going to give you a step-by-step roadmap on how to reverse your type 2 diabetes and get off the medication. What makes this course different than any other course online or in Google is the amount of educational training books you get, along with the video training. Because what I'm doing here is I'm giving you a live video of myself going through each of the training books. Now, our goal is to educate you on the root cause of what's causing your type 2 diabetes. See guys, that's the biggest issue with most health professionals and doctors out there, is they're not addressing the root cause of why you even have type 2 diabetes. And so some of those health professionals might even told you you couldn't reverse it, which we already know that's not true, because there's plenty of doctors out there that have completely changed their platform on treating type 2 diabetes naturally and getting them off the medication. And the other thing is there's way too much scientific case studies proving the same, that all you need to do, is it simple? Yes, when you're given the right plan and tools. All you got to do is change the type of food you're eating, certain foods, and how often you eat. And that's exactly what this course does. It educates you on everything you possibly need to be successful. Now, in this course, you're also going to be getting all the meal plans. There's 3 of them: meal plan 1, meal plan 2, and meal plan 3. Because everything has to be done in stages. You just cannot jump into trying to reverse it, because most of the time people will fail. So there is a process. You're also going to be getting my cookbook. No guessing on what type of meals to eat to lower your blood glucose level. And what's really cool, guys, is you're going to get these meals. Once you see them, the whole family is going to enjoy them. So you're not going to have to worry about cooking 2 separate meals. But let me tell you what makes us so different than any other course out there is a certain tool that you're going to be receiving. It's called a GKI index, and you're actually going to be educated on this. And some of the doctors are even using this for their cancer patients. But we use it all the time because we need to know if the foods you're eating is actually lowering your blood glucose level. Well, the GKI, what that means is called a glucose ketone index. It's a ratio. So to be successful, and I don't see how anybody could be successful in lowering their blood glucose level without doing a GKI. I don't see how they can guess if that food they're eating is actually producing ketones. See, glucose and ketones work together, guys, in order to lower your blood sugar. You have to have both of them together to do it right, and you have to document it. And so what we've done is given you this special tool to document and keep track of your numbers, so that when you call your doctor to start lowering your medication, you have the numbers there. And he's going to look at it and says, yeah, we better take you off 5 units of insulin, or we better cut one of your metformin pills in half. That's what we're trying to do. We want to teach you to document your numbers with these tools so that you can keep in close communication with your doctor so that he can see that your numbers are dropping and start getting you off the medication. That's what's important to us. Guys, we don't even have to worry about losing weight, because when we get the ratio on the GKI where we need it to be, the byproduct is going to be weight loss. You're going to lose weight no matter what. When your blood glucose level starts to drop, guys, your weight is going to drop. It's going to melt off. That's the byproduct. Our goal, though, our goal is to get you to reverse type 2 diabetes and get you off the medication. Because if you have not educated yourself on the side effects of the medication, you need to research your medication and look at the side effects. Because most of you, if you're on the medication for a long period of time, you will get one of the side effects, and one of them is kidney failure, diabetic ulcers, your eyes, losing limbs. You don't want to get to that point. The sad thing is you can reverse type 2 diabetes naturally by just changing the types of food you're eating and how often you eat, and that's what this course is going to teach you to do. And the only way you're going to fail is if you quit too soon and you don't follow directions. But you have to be patient. You have to let your body adjust itself, especially for those of you that have been a type 2 diabetic for years. You got to let your body adjust it. Okay, guys? So, guys, I hope to see you, and we'll see you guys at the next video.